Hey guys, it's Winona aka Blythe Dream. Welcome to another YouTube video. So today I'm going to be talking about my health problems, disabilities, chronic illnesses, whatever you want to call them. So basically my overarching diagnosis is Ehlers Danlos syndrome, and everything you hear in this video has basically been caused by the faulty collagen in my body. So it causes a lot of other things which I'm going to talk about in this video. So to start off with, they usually ask if you want the good news first or the bad news. So since you cannot reply, I am going to tell you the good news first. I was roughly diagnosed with endometriosis by a gynecologist. The year before last, in December, I was actually in hospital, I think for around 10 days because I had this really bad bleed from my bowels, and I had all these different tests and they could find nothing. It was just as I had my period. I had lots cups of blood. Went to hospital, they did all these tests, colonoscopy, nuclear medicine, all this stuff, could not find what was wrong with it. And then after that I saw a gynecologist and she said I'm almost for sure getting endometriosis, and it flares up and then goes away almost as quickly as it comes on, and that means that while it's bleeding, I could be bleeding, and by the time anyone goes in to try and find it or stop it, it's already stopped. So basically she said they could operate, have an exploratory surgery, but stuff might not come up, and also there's no point in actually finding that because she's going to give me the treatment to use anyway if it happens. So I've got a few different drugs, and these are not drugs to start every day. I actually have a Webster pack that kind of organizes all my drugs, which I'll talk about in a moment. It's not to kind of have on a morning-night basis. It's just if I get the bleed, she's given me Ponstan or something for the cramps and stuff. And secondly, she's given me a drug that I think it promotes the closing of blood vessels so you don't bleed out as much. And then she also gave me some kind of other drug that's for controlling endometriosis, but I'm only to use it if I get the bleeds. Strangely enough, that is in the good news category because it's controlled at the moment, haven't had any bad bleeds. Thank goodness I've got all the medication on hand and I know what to do. So number 2 good news is my POTS at the moment. I have postural orthostatic tachycardia syndrome. You can look up what that is, or there'll be YouTube videos on it too. Or if you want me to do my own video about it, please tell me and I will do one for you. So my POTS is pretty well controlled at the moment. I'm on some tablets here for POTS. I am on, I think it's the metoprolol, which even though that's usually for high blood pressure and I have low blood pressure, it helps stabilize either side of the spectrum. I know I'm on the Florinef in here. So those two are for my heart. I'm also on a high salt diet to raise my blood pressure. And also the immune system is going pretty good. I have a similar thing to lupus, but it's more general autoimmune response, especially in the skin, chronic autoimmune urticaria. So I take Zyrtec for that, which is prescribed by my immunologist, and also I take Plaquenil, and he's actually reducing the Plaquenil because that can cause eye damage, but he started me on that on 4 a day, and then I'm going to slowly start dropping off on the Plaquenil, and that has hopefully helped my immune system a lot. So the immune is doing well. I just need to make sure I'm doing the nasal sprays every day, because I always forget to do that, and I have a bit of a blocked nose at the moment, so I definitely need to keep doing that. So the bad news at the moment, so my right arm has been broken twice, possibly due to bad collagen in my bones, and lately it has been like clicking like in the middle of the bone. So that clicking noise is actually coming from the middle of the bone, and doctors have no idea what it could be. I went and got x-rays and nothing showed up. So we have no idea what that could be. I'm going to see a rheumatologist on Wednesday actually, and I'm really keen to know what that could be, because the x-ray showed no broken bones, and the GP is very confused because she said it should not be clunking like that. She said it could possibly be some kind of late stage of arthritis, but that doesn't make sense because arthritis is of the joints, and this is not a joint, this is the middle of a bone, so there shouldn't be any moving pieces in there. It should be, a solid bone. The other thing also ties into that. I've been having problems with my hip where I get this sharp stabbing pain in my hip, and I can't basically swing the hip forward. The leg will go back, but when I go to take a step, it locks up and I can't swing my leg forward. And that also goes back to a leg injury I had a couple of years ago where I couldn't put any weight on the leg, also couldn't swing it forward. I was in hospital for a week because I couldn't walk, and they never found out what was wrong with it. So they prescribed me some Celexi, which I think also goes by the name of Celebrex, which is an anti-inflammatory for arthritis generally. I took that, and basically an hour or less later, all the pain goes away in my hip. So that is kind of bad news because it means it's probably hip inflammation from arthritis, which is not the best. So that means because you're quite prone to get arthritis if you have Ehlers-Danlos syndrome, my hip has been dislocated more times than I could even count, and especially the left one, and that's the one I'm having problems in. So things like hip replacements, etc., are probably in the future now that I've been diagnosed with arthritis at age 21. Fatigue at the moment has been pretty bad. I have been sleeping a long time, 16 hours a day, and not staying awake for very long. I've also been sleeping at night, waking up in the morning, having a 5-hour nap in the afternoon, having dinner, and then going to sleep again. So, getting a fair amount of sleep, and I'm just exhausted all the time from my pain and other stuff. Dislocations, I've been having a lot of dislocations lately, which really sucks. These little fellas have been really helpful. I know they say that things like these don't actually help with joints, but I think with EDS they really do help, because even this much can really stop a joint from coming out if it really wants to come out. It can help a lot. So that's basically my update. If you guys want to see a video about all all the tablets in my Webster pack, please let me know and I'll do a video on that. So thanks so much for watching, guys. I love you all so much. If there are anyone watching, I could get no views on this. Anyway, guys, thanks so much. Bye.